Thermography. So over 30 years of clinical use and more than 800 medical studies have established thermography as a safe and effective means to examine the human body, including early detection of breast cancer, not in exchange of doing a mammogram, but also something that can help you. So have a look.
The greatest risk for developing breast cancer is actually just being a woman. That is incredible that, like, lucky us, that just being women, we're at risk for developing breast cancer. And you said in conjunction with a mammogram, thermography is something that can really help women prevent breast cancer.
Absolutely. So thermography is an imaging procedure in which we use an infrared camera to determine changes that may be occurring in a woman's breast that precede the development of breast cancer. So thermography, compared to mammography, is a little bit different in the information that we're provided with based on having a thermogram done.
Because women usually don't start getting mammograms until they're, in their 50s, and so, but women are at risk of developing breast cancer in their 20s, 30s, and 40s.
Absolutely. So with some of the new guidelines, women are encouraged to hold off on having a mammogram, and so women are often left wondering what it is that they should be doing in order to be monitoring their breast health. And thermography is a great way for women to monitor their breast health. And really, you know, we image women as young as 18.
Wow.
And so it's never too early to get started. And there's there's absolutely no risk, in fact, of having a thermogram done because there's no exposure to radiation, there's no compression, there's none of those things.
It's not a painful experience.
It's not a painful experience at all. In fact, it's actually very beneficial because it provides you with information that you may not otherwise have.
And so it's using a thermal camera that can kind of see the hot spots and the cool spots on your body?
Right. So the thermal imaging camera is used to determine whether or not there's temperature changes within the breast tissue. It's actually measuring the surface temperature on the skin, but that temperature can change on the surface of the skin based on what's going on underneath the skin.
Wow.
So what we want to see with thermography is everything being very uniform, everything being very symmetrical, and of course temperatures to be within a normal range.
Mm-hmm. And so you mentioned that thermography, it actually scans more than just what's compressed in the machine.
Right. So in many cases with a mammogram, basically what they're getting is just the part of the breast that can actually be put into the screening device. With thermography, it's great because we get more of the chest wall. So the upper chest we get in the lymphatic region, so in the armpit. So we're actually scanning the whole breast, not just whatever can fit into the mammogram device.
Incredible. All right, so we're going to actually be learning how it can help prevent breast cancer, so you're going to want to stick around right here.
When used in conjunction with exams and with your doctor and mammograms, breast thermography can help detect 95% of early stage cancers. Katie checks it out.
Well, we're still here at Full Circle, and we're checking out thermography, which is a type of breast scan, Sharon. And right now we're looking at an abnormal and a normal scan, and this right here is normal. So how can you tell the difference between the two?
Well, this is a normal scan, and what we're looking at with this normal scan is that there's just a nice, cool look to the breast. Everything's very symmetrical, everything's very uniform. There's not a lot of vascular patterns throughout this woman's thermography report, and so this is what we would consider to be a normal scan.
And also I noticed that there's kind of just the heat lines, which is under the fold of the breast and the armpits, but that is normal because that's where a lot of heat relies, correct?
Right. There are normal patterns there, and what we're primarily focused on is the breast tissue and this upper region here.
And so what would an abnormal test look like?
Okay, I'll just move to one of those.
And I'm assuming that with abnormal tests is that there can be kind of different variations, not just going to be one type of, you're just going to see red in this area.
Exactly. So when we're talking about an abnormal scan, what we're talking about is a higher risk that somebody has, and the risk changes based on certain structures that may be present within the breast. So this is an abnormal scan. There's a higher risk here for developing disease down the road if this woman chooses not to do something about it. So if you look at here, even just visually, you can see that there is an asymmetrical pattern, whereas the breasts before were very symmetrical, particularly with this vascular pattern here, this red line running through the breast, that's considered to be abnormal, and it increases this woman's risk factor in comparison to a much calmer and cooler looking breast scan that we saw previously.
And so when you do get not diagnosed, but when you are shown to have an abnormal scan, that can be kind of scary for some women, but you don't just kind of send them on their way and off they go home. You can actually help them to maybe help prevent developing something that later on.
Absolutely. If a woman has a concern, or if there are some factors that are present within the breast that shouldn't be there, there's many things that women can do in order to reduce their risk and obviously improve their health. We're not just talking about breast health, but their overall health.
Right.
So we look at nutrition, we look at lifestyle changes, managing stress, of course, taking perhaps the appropriate supplements that are specific to that woman and to her concerns that she has going on. So there's all kinds of things that can be done. It's not just, oh, you have a risk and sorry, we can't help you. Absolutely. There's always something that women can do that's proactive in order to improve their health and change their risk.
Incredible.
Yeah.
All right, well, you're going to want to stick around because next up we have a client that we're going to be doing a scan on. We'll see you guys soon. Full circle, and we've been learning all about thermography breast scans today, and we've learned so much information about this. I find it absolutely incredible.
Great. Well, today what we're going to demo is a little bit how a thermography session goes. So usually what we do when we have women come in for a thermography scan is we have them obviously disrobe their top clothes because we're imaging their breasts. So we have them sit in an enclosed area so as to alleviate any kind of stress that may be involved sitting there half unclothed. We do allow women to climatize to the room temperature. So today we didn't set up all the parameters as I typically would, but usually we have the room temperature set between about 18 and 22 degrees, and we keep it very stable. So whatever temperature we start with, we like to finish with at the end. We have the women climatize to the room temperature. That way we have a really consistent imaging environment to start with. So what we do is obviously after the 15 minutes has gone by, we put information into the system about a woman's health history and any concerns that they may have. We then do a series of images. So here you can see we have a straight on view. We do image women at several different profiles. So I'll just demonstrate. So if you can put your hands on your head, and so we would take an image such as this here, and we would save that. We then would have the lady who is here for imaging turn so that we essentially tell them to...
Oh, so you can get all angles of the body.
Absolutely. So we're getting a whole variety of angles and different positioning. So we're getting, oh, she just turned, but that's okay. So there you go. And then if she turns straight into facing the wall, we're also getting... No, turn and face the wall. It's okay. So we're also getting like the lymphatic region underneath the breast. When they do face the camera directly, they're in a position in which we're also getting the thyroid.
This is an extremely comprehensive scan.
Absolutely. So we do that, one set of images. We then put the woman through what we call a stress test, or better known as a cold water challenge. So what we have them do is soak their hands in a bucket of 10-degree water for 1 minute. And what that stress challenge does is it changes the way blood vessels constrict or respond. So normal blood vessels will constrict, and that's a completely normal physiological response. Blood vessels or areas that may not be working as they should won't have that same reaction, and in our follow-up scan, once we scan after they've done that cold water challenge, it provides us with more information about abnormalities or inconsistencies that are occurring within the breast tissue. Once the cold water hand soak is done, we let them relax for 3 more minutes, we re-image again, and the whole procedure is done. So it takes 20 minutes from start to finish, and it's completely painless, it's not invasive, it's very easy, it's very simple, and
incredible.
Yeah, no exposure to radiation or anything of that nature.
And so how often do you recommend that women do get a scan done?
For women who have some concerns, so let's say they have a higher risk factor than other women, they may be requested to come back in about 6 months' time. Other women are 9 months, depending on their risk factor or any concerns that they have. And then, of course, women who have normal scans, we generally see them on a yearly basis.
Amazing. All right, well, for more information, you can always call Full Circle and learn all about thermography. We'll see you guys later.